Smith, Clinical Officer for Hartford Healthcare. We're going to start our daily briefings. We'll start with the number of patients we have right now. We have 273 patients across the Hartford Hospital acute facilities. We have 6 patients who are positive in Bacchus Hospital. Charlotte Hungerford has 18 patients. Hartford Hospital has 121 patients. MidState Medical Center has 16 patients. St. Vincent has 72 patients. Hospital Center Connecticut still has 35 patients. And Wyndham Hospital has 5 patients. Total 273 patients across our acute facilities. We also have 215 patients being cared in the community network in the home care and nursing home space. And behavioral health network has 2 patients in our COVID units. Just to talk a little bit about the number of patients we are caring in the hospital right now with the 273, it's definitely a lot lower number than in excess of 420 we had during the peak time. This is a good decline over the last 2 weeks or so. But still, as indicated earlier, it's a slow decline. It's not a precipitous decline, and we're going to continue to see this numbers for a long time. I anticipate that we will have some patients of COVID patients in the hospital for many, many months to go, and that would continue as the trend goes forward. As you know, Connecticut's still adding in active cases. Mortality is still being counted upon, and although the hospitalization rate is going down, and that's a positive sign. To give you some other updates, our virtual visits, as we started back in March to really support our community to be providing access to our specialists in primary care and behavioral health network, we have over 82,000 or so behavioral virtual visits completed right now. I'm really impressed by how community is reaching out and connecting with our teams right now, and this has allowed us to be able to connect and provide the care in the regular times. These virtual visits are utilized for both COVID-related or non-COVID-related episodes. There's a significant growth in the behavioral health network virtual health visits as well. We continue to receive plasma and transfuse plasma. We've done more than 215 plasma transfusions across the state, across our network so far, and we continue to go on doing that. Essential surgeries and the surgeries which were put off, postponing by a variety of our community members are very gradually coming back. We have increased demand. A lot of people are calling in right now, so we're going to accommodate as best we can and gradually ramp up as time go by. We're doing all sorts of safety precautions, obviously tremendous amount of focus on infection control, the audits and checklist, and a few other things we've been doing. Hartford Healthcare has created its own checklist to make sure that we look at all possible safety measures to make sure that our facilities are as safe as we can be for the patients as we go forward. We're doing random audits. We're making sure that we have a 24/7, 365 days type approach on safety precautions, especially about infection prevention at this time. Going back to the telehealth and virtual health, I see this and demand is going to continue. We're going to continue to provide the service as we go forward for our community. I do want to highlight that as we are seeing increased amount of concerns and reports coming out about the impact of COVID-19 on behavioral health, we consider our responsibility to be able to support our community as we go forward. With that, I am going to introduce my colleague, Mr. Eric Arlia, who's our Senior Director for Pharmacy for Hartford Healthcare. Eric.
Good morning. My name is Eric Arlia. I'm the Senior Director of Pharmacy here at Hartford Healthcare, and I wanted to come back on this morning and give a little bit of a follow-up on the drug Remdesivir. We had spoken about that last week. To go through the timeline in brief, on May 1st, the FDA granted an emergency authorization approval for Remdesivir for treatment of COVID-19. It was also announced on May 1st that Gilead, the company that has developed this drug, was donating 1.5 million doses at no charge to treat patients. So we have been waiting for direction on how that would be distributed. When I spoke last Tuesday, we were waiting for confirmation on that. So I'm happy to report this morning that this past Saturday, we received word that the allotment of the drug for the state of Connecticut was received by the Department of Public Health. And despite it being on a Saturday, I really want to compliment both the Department of Public Health, the Connecticut Hospital Association, and our clinical leadership at Hartford Healthcare, as well as our pharmacy departments. We were able to take receipt of our portion of the Remdesivir on Saturday afternoon, and we were able to distribute it to all of our acute care hospitals on Saturday evening. So over the course of this weekend, we have had patients who have had therapies for Remdesivir started in many of our sites. Our clinical leadership team, along with clinical pharmacy, has developed usage guidelines for Remdesivir, and those guidelines are based off of the recommendations from the FDA on the emergency utilization authorization. So we're very happy to report here this morning that we're beginning to use the Remdesivir in appropriate patients in many of our institutions, and we will continue to, I'm sure, grow that number over the next few days. And we're awaiting word now from the Department of Health and Human Services on the process for ongoing distribution of the medication. So really positive news to report this morning, good follow-up. And as we mentioned last week, Remdesivir is the first antiviral drug that has shown early clinical efficacy against COVID-19, so it's really a new weapon in the toolbox for our clinical providers treating for our most sickest patients. Thank you. I'm going to introduce Dr. Kumar to come back now.
Thank you, Eric. Eric will be back for any questions or answers you have. In the meantime, I have such a pleasure of introducing my colleague, Lori Nohilly, who's the Director of Nursing for MidState Medical Center. Lori?
Good morning. So my name is Lori Nohilly. I've been a nurse for 35 years. I'm the Director of Nursing here at MidState Medical Center, and I cover all of the nursing units, including critical care and respiratory therapy. I wanted to share with everyone what the last 7 to 8 weeks have been like in the life of a nurse in here at MidState Medical Center. We have worked diligently with Hartford Healthcare and our executive leadership team to turn our 9-bed ICU into a 24-bed ICU on one of our units. We had the assistance of our facilities and clinical engineering. We added ventilators and monitors that we received from the system in order to take care of these patients. We are starting to see our numbers leveling off, as Dr. Kumar had said, but we are still having patients coming into the hospital every single day, so this is far from over. Some of the difficulties that nursing has experienced, I think if you ask any of our critical care staff, is the ability to help families say goodbye to their loved ones when there's a visitor restriction. So the nursing staff is the loved one in the room with that patient, holding their hand, having them look through the iPad from family member to loved one in the bed, and having that family say goodbye via an iPad. You hear the emotion in their voice, which is very heart-wrenching for the staff to experience, but they've done it over and over again. The good news is there are also a lot of people going home. We do celebrate them as they leave the hospital. Their length of stay could be anywhere from 2 weeks to 2 months, but we are seeing people go home, so that is some good news. From my staffing perspective, in the 7 units I run, I think their biggest fear is how rapidly this disease progresses and the fear of bringing it home to their families. So they too are concerned, but we're able to give them and have always been able to give them here at Hartford Healthcare the PPE that they need to take care of these patients. So we've never had an episode of where we ran out of PPE and we're unable to safely protect our staff. Some of the things that keep the nursing staff, the respiratory therapy staff, the physicians going every day is the amount of support that we've received from Hartford Healthcare as well as the community. There's never been a day here at MidState Medical Center in these 8 weeks that we have not received some sort of donation from the community, whether it be gift cards, coffee, food. We've had children raise money for their birthday and donate their money to provide food to the frontline staff. So the community support has been phenomenal. And I know that's been pretty much every hospital in the system has received that support. The thing that keeps us going every day is the great leadership we have, our culture here at Hartford Healthcare, and the great managers that are on the units 24/7, supporting their staff, making sure that they're felt that they are being heard. When they have concerns, we arc them up to our leadership team, and we're able to resolve them. So although we do see our numbers leveling off, I would caution the community to continue with their social distancing, practice good hand hygiene, and follow the CDC recommendations. Thank you, Dr. Kumar.
Thank you, Lori. What a wonderful summary you provided. Thank you. At this time, we'll open for any questions.
Hi, it's John Delacoste. I just wanted to reach out. We've heard in New York State, Governor Cuomo expressing concerns about children getting Kawasaki disease, and I wanted to see whether or not you've seen any kind of incidents like that at HHC, and also what you are looking at in terms of is that something that you're concerned about, or what's the thinking right now?
Well, thanks for asking. As you know, this coronavirus has been quite an interesting virus for medical community to manage. Every single week, or looks like every single 10 days, we learn something new about this virus. This latest episode of what's been reported in New York is obviously very concerning. And it almost seems like this virus is attacking a different way of in children. And we had some respite, and we were so fortunate to not have said children's been affected, but now this increased case report, which is happening primarily from New York, but other states as well, has been quite a concern. I did speak to our children's hospital lead last week, and I wasn't informed of any individual case which we know, at least in CCMC and throughout the Hartford Healthcare as well, as of last week. We are going to continue to keep an eye on that. We're going to continue to obviously pay attention to that. But at least to my knowledge, across the system, we don't have any cases of that concern at this time. I'm hoping that we will have our pediatric specialist come and talk to the media at some point and talk about it. I'm not a pediatrician, so I like to make sure that I talk about the things I know very well.
One other question, Dr. Kumar. I saw this over the weekend, I believe it was, that in some areas where people have a higher dosage of vitamin D, they've seen a reduction in number of cases. I was wondering if that is something that you looked at, or is there any correlation that's actually being discussed on that front?
Yeah, so we in Hartford Healthcare, we have not looked into that as of yet. There is just to go back so everybody's awareness, there is some studies been indicating, these are retrospective studies looking into the individuals who had high vitamin D level had less or no effect of coronavirus. Now, these are what I describe as a causation rather than association rather than a causation. We don't know actually vitamin D protects it, but we know that the individuals who didn't have it have a higher amount of vitamin D. So depending on how the scientific community looks into that, unless we have a large-scale study, it's difficult to comment on that. Look, vitamin D is, most of the population living in this part of the hemisphere generally runs a little low on that because, the exposure to sun and other things. So taking some vitamin D and protecting yourself is never a bad idea. But at the same time, we don't know whether the vitamin D is going to prevent or can be used as prophylactic medication for the coronavirus. However, anything we can find right now is encouraging. So this is something we're going to keep an eye on that at this time.
This is Emily Brindley from The Current. I had a question about Remdesivir first.
Mm-hmm.
How many patients can be treated with the amount of the drug that Hartford Healthcare received?
I'm going to have Eric answer this one.
Okay, thank you.
Hi, so here at Hartford Healthcare, we received enough doses to treat about 50 patients. And that's with the dosing guidelines that we are going to be employing, which uses 6 doses per patient. There's a couple of different algorithms out there. One of them uses 10 doses, one of them uses 6 doses. Again, keep in mind that we're still really early on in the discovery process with all the studies that are active and ongoing, but some very early indications from studies that Gilead is running is that the 5-day regimen that uses 6 doses total is seemingly equally effective. So our clinical leadership, in the interest of being able to treat more patients, felt comfortable using that as our standard at this time.
And how many patients have been treated up till now
So we just
with Remdesivir?
Yeah, so we received the doses on Saturday night. We're probably in the range of 10 to 15 patients at this time.
Okay, great, thank you.
Yep.
And then Dr. Kumar, I had a question for you as well. So late last week, the governor signed an order so that anybody can get a COVID-19 test. Does that change the process of testing at any of the Hartford healthcare sites?
Yes, we would not require any prescription any going forward, and we'll offer the testing to anybody who deserves it, who wants it.
And is it do people still have to register and make an appointment?
We prefer folks to register and make an appointment because it allows our managing drive-throughs to be differently. We prefer a physician connection, a callback at this time, but it's not mandatory at this time.
Thank you.
Bridget, it's your turn. You're generally the next one.
I knew you were going to say that. I do know that quite a bit of testing has been done through Hartford Healthcare, and the first responders have been very appreciative of that. And I just wonder, is there any early indication of the percentage of asymptomatic folks out there, and especially among the first responders, or is it just too soon to know that?
It's a little too soon to know that. As you know, when we have testing done without our orders, we don't always come to know the results as well. The individuals are getting results from the lab testing. So it's difficult to do a kind of a prevalence analysis on that part here. But I think there's some data which you look in the New York and other areas that are coming out that the asymptomatic conversion rate is still low, which is we're going to learn over in Connecticut how it implies. I think over the next week or two, we'll have a bit more clarity around that. I'm sure the state will put some details around that as well, which would be much better data, in my opinion, than what I would be able to provide. But Hartford Healthcare, as you know, we're going to continue to expand. We have a capability to do so, and I think we'll get a bit more clarity as we go by.
Okay, thanks.
You're welcome. Any questions from the Facebook? No. Very good. Since I've got everybody, I think I'm going to mention about this concern about the mental health and the behavioral aspect of this COVID-19. I think we all need to be aware of this disease and the rising socioeconomic pressures, the rate of unemployment, and where we are right now, it does pose significant problems to the community and patients and everybody else. Every time we've had this kind of events, it raises the challenge for our community to maintain our focus as we go forward. I do want to remind everybody, the Hartford Healthcare has a large behavioral health network. We're supporting through our colleague support center, our colleagues across the system. We do want to offer to the community as well. Though these are the challenging times, and we're going to continue to see that for a long time to come. As some of the media reports over the weekend regarding the number of possible suicides and alcoholism and substance abuse, which keeps increasing, especially after the event we're seeing right now, the pandemic and the other economic challenges. These could be tough times for communities. We want to make sure that people know that resources are here. We're here to support. We'll continue to do what we can do to support our people at this time. So I just wanted to make a last plea on that. Thank you. Very good.